to talk about health matters. Thank you for joining us on the program. I'm Yomi Otaigbe. Today on the show, we'll be exploring issues around patient safety with a focus on patients' rights and responsibilities. From your right to quality care to your right to refuse treatment. We'll also dive into the responsibilities every patient carries, such as providing accurate information and respecting the boundaries of health workers. Do stay with us on the show. The World Health Organization's Patient Safety Rights Charter, which supports the Global Patient Safety Action Plan of 2021 to 2030, integrates patient safety with human rights, emphasizing access to safe care, dignity, informed consent, and fair resolution, empowering patients and promoting transparency and accountability in healthcare globally. Today's conversation is geared towards eliminating avoidable harm in healthcare. Joining me in the studio for the discussion is a two-term past chairman of the Lagos chapter of the Association of General and Private Medical Practitioners of Nigeria, which is now known as Association of Nigerian Private Medical Practitioners, Dr. Adeyeye Arigbabowo.
Good afternoon.
Thank you for joining us. Dr. Arigbabowo is also a specialist family physician and the chairman of National NMA Committee on National Health Insurance Authority matters. Thank you indeed for your time here.
Thank you, madam.
So let me start with by outlining those 10 fundamental patient safety rights. Let's start from the right to timely, accurate, effective and appropriate care, right to safe healthcare processes and practices, right to qualified and competent health workers, the right to safe medical products and their rational use, right to safe and secure healthcare facilities, to dignity, respect, non-discrimination, privacy and confidentiality, right to information, education and supported decision-making, right to access medical records, the right to be heard and for fair hearing, fair resolution, and the right to patient and family engagement. So these 10 rights, on this scale of 10, how would you say Nigeria is faring in terms of patient safety?
Thank you very much. I think so far, the country is trying. It's rather unfortunate that a just state is one that is ruled by just men. We need to have structures that work on ground. We need to have appropriate human resources, so to say. We need to have enabling environment. The rule of law should also be handy. At the same time, rights and responsibilities, they go together. No one afore and no one behind. So based on this, I will rate us doing fairly well, if not for the JAPA syndrome and other things, especially infrastructural layout of the country, and then whether the environment is enabling or not. These are the limiting factors. Otherwise, we should also remember that education plays a lot of role. So we need to ask ourselves, what's the level of our literacy? What's the population by percentage that are literate to the extent of being able to read and write, and then communicate appropriately, so that when we're talking of formal and informal sectors, which make up the entire population, there should be fair, proportionate population management. So I would say, when doing too poor, neither are we doing or climbing so fast. Our challenge is that we are marching.
So you don't want to take it on that scale of 10. You just want to say we are doing...
We are marching. We are trying to do the best we could. But if you ask me to rate us, perhaps we are 3 to 4 out of 10. Perhaps we are 3 to 4. out of 10.
That's
because of the
that's
limiting
below
the average, because of the limiting factors aforementioned.
But that is a very serious one, considering the fact that patient safety is very key. Now, let me quickly show you some of the things that the World Health Organization also said about unsafe care, which is a major public health problem that affects millions of patients worldwide. According to a recent systemic report, 12% of patients experience harm across different medical care settings. And that's about 1 out of 10. That's more than 1 out of 10. That's 12%. So this is a serious issue, and we know that in the country, as you said, we have limitations. But how then, particularly some of this harm that we are talking about, they are highest in specialized areas like emergencies, surgeries, and all of that. So what are those challenges? Let's look at it. You've mentioned JAPA. Let's talk about the education of our health workers too. Let's talk more about that knowledge in being able to do that which is right and all of the parameters around it.
Thank you. When you come to human resource, especially the healthcare workers we have in Nigeria. Nigeria has one of the best set of well-trained health workers in the world, as attested to even by the international community. Doctors are very sound, the nurses are sound, all other groups too, they're very sound. It's just that it is not easy to put on the candle in order to show the sunlight direction. So, give and take, I will say that knowledge base, Nigerian health workers are highly knowledgeable. It's only that putting a new wine in an old jar may just not be a very good fit. So, those are the challenges. So, apart from the JAPA issue we're talking about, security matters are there. You call on a health worker to come attend to emergency. You will have to look right and look left. Am I safe to move? Is all well? Even if anything happens to me, and maybe I'm kidnapped, or maybe something happens, what are the chances that I will turn back to base? And you only know where you are going out. You don't even know where you are coming back. So this fear is there. The phobia is there. The paranoid feelings are there. And apart from this, maintaining even your family around you, you're leaving your wife, you're leaving your children, you're leaving your husband and other members to go and attend to emergencies. Issues may just so well arise.
So we understand that, yes, there are some of those challenges that we need to face or we are facing in our healthcare system. But let's talk about the fact that, okay, as a doctor, as a nurse, or any other health workers, you are on duty. We have been to some hospitals, particularly public hospitals, and I dare say some private hospitals too, where you see that the healthcare worker is so lethargic. He or she does not show so much empathy as to your plight. Okay, you have come in and they ties you up and say, just sit down there. That urgency in terms of medical services, sometimes you find it lacking. Is that we can't put it on infrastructure? Let's talk about that.
Thank you. Ordinarily for the health worker, there are some qualities or there are some display that the incoming or potential patients, for example, clients, will be expecting to find on ground. You want to see a health worker will be compassionate. You want to see one who will communicate. You want to see one who will welcome you. You want to see one who will have competencies. You want to see one who will also document all of whatever he or she is doing with you. But I want to tell you, one of the lacking issues on ground is motivational issues. How motivational is the health worker you are coming, or how motivated is that health worker you are coming to meet? We are all human beings, and I keep telling people health workers are not super beings. That's psychological aspect, that biopsychosocial issues that will not even make the health worker also to be a potential patient you are coming to meet, just like you are saying a patient is coming to meet a patient, because the health worker you are coming to meet is a human being like everyone. Some are bringing in from home what could have been their domestic issues. And when you come also, when they come to duty, how is the work environment? Is it enabling as you are working? Maybe all the tools, are they on ground? And if they're on ground, how motivated are you as a worker? Then again, the education of even the person coming to seek health care, for example, is key. They also have responsibilities as they are coming in or coming on board.
We'll talk about the responsibilities of the patient. I just want us to look at the safety aspect.
So we have to look at the helicopter view, the global assessment of the healthcare delivery environment. A lot of factors will amount. Energy. What is it about energy? That is power supply, where you want to work, equipment you want to use, how durable, how modern are they? Hope they are not equipment that are obsolete. And apart from that, you look at the organogram that is set up. How are you motivated as a health worker by your seniors or your colleagues? For example, iron sharpens iron. So the client that is coming, the patient that is coming, is expecting to come and meet an environment that is globally acceptable and accepting his or her presence, for example. But on arrival, if what you have come to meet are just almost the opposite of your expectations, definitely that patient may also be coming in, for example, in despair, in anger, in disarray, and probably in disappointment.
But I thought, of course, that issues of the environment is part of the training for medical workers.
Yes.
So yes, they are all humans. They have issues, but when you have a matter of life and death before you, how else would you manage your own issues?
Thank you.
Because that is your calling.
Thank you. Recently, the Hippocratic Oath has just been adjusted or amended, even right from Geneva and over there, that I will take very good care of my own personal health. And I repeat, I will take very good care of my own personal health in order to enable me dispense proper care to my patient. And that's what I meant when I said, will it not almost look like a patient coming to see a patient? So we all have to understand the fact that even the health caregiver is expected to have taken care, for example, of his or her health before coming over to take care of others. That's where the enabling environment, the job satisfaction comes in. Job satisfaction is not something you take from the rack. It has to be an understanding between the employer and the employee. So getting the best out of the employer must prepare the stage ready.
No problem. So that is given that there should be the proper environment for health workers. Yeah. But the health worker also knows that it can be liable in terms of, violating the rights of the patient, which of course we talked about earlier. How much of that do health workers also in Nigeria know, that you need to treat the patient well so that you are not liable by law, violating those rights?
Thank you. I think at times too, it's almost an issue of giggle, garbage in, garbage out. When the work hours, for example, you match it with the workload, you match it with potentials and ability of getting the best out of the health worker. At what level do you start having what you call diminishing returns? If the patient...
But diminishing return is not, I don't know how much of it is recognized by the law, because you know that the patient has a right to effective treatment. Yeah. And you are the one on duty. Let's assume that all of the parameters, or most of them, are okay for the doctor. The work environment is good, the equipment are there, but just that because of one thing or the other, that medical worker is not doing what he's supposed to do. How much do they also know that they can be liable for their acts?
Thank you. Right from the medical school, you are taught about medical jurisprudence. You are taught about the laws that will guide your practice. Even the MDCN will give you a booklet as you are being inducted, for example, to guide you, to remind you of the laws that guide your practice. Yes, every profession has what you call professional hazard. So you taking it up is just like a soldier, knowing you're going to the battlefield. You know you're on the battlefield, you either return or you sustain injuries, for example. The same thing with health workers. Every health worker must prepare for the worst case scenario as you are going in to rescue your patients, so to say. Come were the days we used to even do mouth-to-mouth resuscitation, for example. With technology, all these things, and then communicable diseases that have become especially the incurable ones. Everybody wants to take caution. And again, the practitioner, as you see, even in advanced countries today, I can tell you, they are doing what you call protected or protective practice, something that can protect you against litigation. Even when the health worker knows the aggression that he or she can show in managing this case, for example, you may not necessarily get the best out of such person because of issue of litigation. It is not every time that health worker will take it that, oh, I'm aware I can have litigation. Let me also give out my best. In the course of your giving out your best, you may even have complications coming up. So the chances of complications coming up in care or during care, they are there. They can naturally flow in or they can be incidental. For example, you are going in to do an appendix operation as a surgeon, and on the way, you're meeting some other pathologies which were not part of what you had ever discussed with the patient. So there and then, issue of diagnosis, whether it is right or wrong, will come in. Issue of what you call comorbidity, other diseases existing around the area you are going, undetected before you are going in. It's not all the time that all of the diagnostic procedures will make everything 100% clear. And as you are moving in, you are meeting other things on the road, on the way, in an attempt to take care of them before you even go for what you were assigned to do or what you agreed with the patient to do. It's already under anesthesia. It's even sleeping off, for example. Who are you going to discuss with? That's why part of the consent should read, for example, I'm going to leave the limitations and the extent of this surgery to the discretion of the surgeon. So it's possible you're going in, you meet other things, complications will come in, and thereafter, it may not even be an excuse for you as a surgeon. When issues arise from the primary assignment you agreed to do, issues now arose. You are now saying the first 30 minutes, I use it to solve ABC problem. So educating the patient, the physician and the patient must have mutual understanding, and it's a give and take event where you are going to say meet, treat.
Okay, let me quickly remind our viewers that they can share their experience with us. You can call the number 0808-8054-2233, 0808-8054-2233. It's right there on your screen. We'll be winding down on this, and I would want you to speak to how this relationship between the health worker and the patient can get better. But let's quickly see those responsibilities that patients also have. We'll have patients to provide accurate health information, patients to understand and follow treatment plans, ask questions to ensure safety, fostering shared decision making for better outcomes, treat healthcare providers and other patients with respect, avoiding abuse or violence. That's part of all of the things that the patient's responsibilities are, and also observe safety policies and procedures, fulfill financial obligations for services, and report concerns about safety or care. We'll come back to that report so that the people can know exactly where or who they should report to. But now let's talk about how we can make this relationship between the patient and the health workers safer, particularly in terms of delivering the healthcare service.
The first assignment is to remember there are three categories of professionals are mutually respected. Even the Queen knew it those days. The clergyman, a doctor, and a lawyer, for example. And so these individuals, the first part of this relationship that should make it mutual is to the extent that the physician and the patient must be very friendly. They must have mutual trust one for another. one for another. So in this situation, whether we like it or not, two cannot work together except they agree. So there must be trust, mutual trust, and there must be transparency. Both parties must be transparent. When the client is coming in or the patient is coming in, they must be ready to volunteer all of the story, all of the medical history, all of the drug history, while the physician must also listen. So it's a give.
And so if there is a case or a concern that the patient has, where or who should the patient be talking to?
The first the patient should talk to is the physician. It is now when it is your word against my word. For example, the physician, the patient or the client has that responsibility, for example, of seeking a second opinion. The patient can seek a second opinion, and that will help the patient to establish what he or she is assuming. That is the starting point.
All right. Thank you so much. I wish we have more time, but of course it's something that we can still talk about on the show. Thank you for your time and insights on health matters. Dr. Adeyeye Arigbabu, past chairman of the Lagos chapter of the Association of Private Medical Practitioners of Nigeria.
Thank you very much.
Thank you indeed for your time.
Thank you very much, ma'am.
And let's see what's up on our news segment. The Imo State Government, through Heartland Hospital Management Corporation Limited and Imo Digital City, has signed a Memorandum of Understanding with Prostate Cancer Limited, an organization led by Professor Kingsley Ekweme, a renowned consultant urological and robotic surgeon, to establish a robotic surgical center and manage specialist hospitals in Imo State. The initiative marks a major step in advancing technology-driven healthcare, with the center set to deliver minimally invasive procedures using state-of-the-art robotic surgery systems to improve precision, recovery time, and patient outcomes. Speaking at the signing ceremony at the Government House in Owerri, Governor Hope Uzodinma reaffirms his administration's commitment to attracting strategic investments and strengthening public-private partnerships to modernize healthcare delivery.
That will attract medical tourism into Imo State. Treat our people. Our people have access to good medical and all the rest of the thing. So the whole thing about prosperity, development, awareness is gradually gaining momentum. So for me, this is a major breakthrough to our medical program for our people.
In a bid to ensure quality healthcare delivery at the grassroots, the Kebbi State government has upgraded a primary healthcare center in Kuka Ward, Kalgo local government area of the state to the status of a general hospital. Governor Nasir Idris made the announcement during his visit to the local government area to inspect the ongoing total revitalization of the facility. Expressing satisfaction with the level of work carried out, the governor directed the immediate posting of medical doctors, nurses and other supporting staff to commence services at the hospital. He also approved the installation of a 50-kilowatt solar power system to enhance service delivery and ease the working conditions for staff. Finally, two new global reports released by the World Health Organization indicate that sugary drinks and alcoholic beverages are getting cheaper due to consistently low tax rates in most countries, fueling obesity, diabetes, heart disease, cancers and injuries, especially in children and young adults. The reports show that at least 116 countries tax sugary drinks, many of which are sodas, but many other high sugar products such as 100% fruit juices, sweetened milk drinks and ready-to-drink coffees and teas escape taxation, while 97% of countries tax energy drinks. This figure has not changed since the last global report in 2023. The WHO is calling on governments to significantly strengthen taxes on sugary drinks and alcoholic beverages. The reports warn that weak tax systems are allowing harmful products to remain cheap, while health systems face mounting financial pressure
from preventable, non-communicable diseases and injuries.
Thank you for sharing your time with us on Health Matters. Keep it locked on Channels Television and do stay safe. I am Yomi Otaigwe. See you next week.